the long-term impacts of gender-based violence are absolutely profound and far-reaching, but not only for survivors, but also those around them as well. So whether that's friends, families, entire communities. So witnessing abuse in itself can have a degree of ripple effect. So we've seen in lots of research studies, and also, I mean, just in lots of experience that we've had also working with survivors, um, that actually it creates a cycle of trauma that extends beyond the survivor. So for friends and family, seeing a loved one endure violence can lead to secondary trauma in its own right. Also, there's feelings of anxiety or helplessness, and in particular for children who have witnessed violence, particularly seeing that exposure to violence in the household, whether it's directly or indirectly, can also have lifelong consequences. And this is something which I don't think we tend to think about enough. So, being a child in that environment can can have real physical consequences, so potential developmental delays or physical health conditions later in life. So there's impacts in the immediacy, but also there are impacts in the community beyond also those immediately affected. So even at a community level, I think it's worth just considering that widespread gender-based violence actually creates effectively a culture of fear and almost normalization of abusive behaviors. I suspect actually the National Council will probably chip in on this, but just having so much exposure to violence in so many different contexts, it almost erodes trust and social relationships just in society as a whole. So, these societal costs are huge and huge in their own right. But just very briefly, sort of answering the second point that you mentioned. So, how should we respond if we are witnessing abuse? Um, I think the most important concepts are our responses should be informed, compassionate, but also guided by an understanding of that particular survivor's safety and autonomy. So there's a few steps that we can take. So most importantly, absolutely about prioritizing safety. So if you yourself have witnessed any immediate harm, do call emergency services or relevant authorities to ensure your safety and also the safety of the survivors, because just as you mentioned, such interventions can also save lives in their own right. But if you're talking about something in sort of the longer context, I think one of the most important things that I've seen actually is to be a good bystander in that context, you've got to be a really supportive and compassionate listener. So if the abuse isn't immediate in that context, but you know somebody who is in an abusive situation, do approach them with care. You've got to listen without judgment and avoid any degree of blaming language. I think this is something which, as a society, we don't do particularly well at the moment, but it's something which we really need to focus on. And also just let them know that you're there to support them. Ultimately, survivors do need to feel empowered and not controlled in this situation. But you want to empower them so they can make the best decisions about their own sort of situation and care. And probably the last thing that I'd just really focus on is I think everybody in society and community also has a duty to be able to have a degree of understanding of how to provide information or resources if you know somebody who is in this situation. You don't have to be an expert in this space to know that there's certain, big national charities, big organizations or support pathways that you can direct people to. And actually, many survivors themselves, due to that situation, just may not know where to turn or feel too isolated in that moment. So I think it's really important for us to really step in. And actually, just the last point, because it's also linked to what Elsa and Natasha said in the introduction. But I think we also have a duty as well to also challenge some of those harmful norms that we have at a societal level. So I think that's also important within our response if we're witnessing abuse. We do have a responsibility to speak out against attitudes and behaviours that do condone violence, but obviously whilst maintaining a degree of safety yourself as well. Very specifically, just on that point, actually, how do we sort of match services to survivors as per their need? This is something which our team's been doing quite a bit of work on sort of since the pandemic. So during the pandemic, the Department of Health and Social Care through the National Institute of Health and Care Research funded our team to sort of undertake a mapping exercise to get an idea just in terms of what the current service provision looks like in terms of remote support services. So as if everyone can cast their mind back to the pandemic, obviously there's a big shift in terms of no longer able to provide face-to-face services, thinking about sort of what the remote service options look like. And actually now we're a few years from what the back end of that sort of immediate aftermath of the pandemic was. We've still seen that a lot of services have still sort of reverted either to a hybrid or a remote sort of approach. So our team actually took a slight diversion actually just in terms of some of the work that we did. So originally we were sort of commissioned to do some work understanding what the services are that currently exist. And in particular, what we're quite interested in understanding is which of those services have been evaluated And actually, also quite importantly, which is picking on a point that Elsa mentioned, so when services have been evaluated or services are provided to certain groups, could they possibly inadvertently widen inequalities in some groups? So sometimes when we look to create a service, we don't necessarily think about how they affect every member of every subpopulation who might engage or use that service. So actually, Natasha mentioned that concept about intersectionality. So sometimes, services might be created for a specific ethnic group or a specific socio-demographic group. But the truth is that, if we take ethnic groups, for example, there's so much diversity within certain groups actually that often, even a service design in that space sometimes doesn't work effectively and could inadvertently widen inequalities. So we did a lot of work sort of mapping what the current service provision looks like in the UK, and to provide that information to the government to give an indication just of sort of where the needs are. And we're really delighted to see actually that one of the government's responses is that they're now funding a lot more research money and sort of evaluation money to try and understand, what the impacts of certain services are. But something really exciting and interesting also happened during that process. So, as I mentioned right from the start, I think if we want to do effective research or effective work in the space, it's really important to have the voice of survivors at every step. So, alongside a lot of that work that we did, we consulted at every stage with lots of groups of sort of survivors of victims of violence. And, we realized a very important point, which is, in some ways something that we tend to overlook sometimes in academia, but if we have gone through the effort of creating this, undertaking this mapping work, creating these directories, can we do something more effective or useful with that information that could actually benefit survivors? So, a lot of our survivor panels suggested the idea of actually developing that into a mobile app. So that's just an example of a tool just to help survivors identify specific services that might sort of address specific needs. So there's no quite sort of tools that exist like that on the market at the moment in this context. So, what I mean by that, for example, if you're a member of a certain intersectional group, are there potential services that you just may not have been aware of that could be in your local area or also more broad? I think one of the things that the pandemic really showed us is moving towards more digital tools like this. One of the really exciting things in this particular field is that previously, if you, for example, lived in a rural area, your access to certain services was quite limited. But actually, since a lot of services have moved to more hybrid or virtual options, a lot of survivors now also potentially have access to services outside of their region. So that kind of connecting those dots is something which has not really happened very, very seamlessly since. But there's a great opportunity in doing so. So we spent quite a bit of time just trying to put that together. So that particular app is not yet released, but it's hopefully going to be released actually within these 16 days of activism, which is quite exciting. But I think just more broadly speaking, so the role of tools such as that or others, I think in improving access it can be really transformative. So I think for survivors, just as I mentioned, these kind of tools can eliminate some barriers, simplifying the process of sort of finding that tailored support. And I think just also speaking actually also to a point which Elsa had mentioned, also I guess Natasha touched on this as well. If you are a survivor of violence, we're in a really, you can be in quite an overwhelming position, not just in terms of understanding what's happened and processing the trauma, but also in terms of understanding the support pathway that exists depending on your personal needs. So what I mean by that is yes, there are lots of, we're very fortunate that there are some front door services, but then actually the pathway after those front door services can be quite a mystery and also quite convoluted depending on your personal needs or personal expectations, just as Elsa mentioned. So tools, solutions, digital options like this can kind of hopefully streamline some of those pathways and actually provide filters or sort of approaches like that. So I think that's really important. And then just linked to something which I mentioned earlier, these sort of tools can be also quite helpful for bystanders or people who witness abuse as well. I mean, just as we sort of, many people want to do something to help, but sometimes you just don't know where to start in this space. And having just access to tools or being aware of tools like this is at least a starting point. So hopefully it just empowers communities. But just as I guess just as a third point, as I briefly mentioned, these sort of tools can have broader impacts just on accessibility as well. So hopefully they can break down barriers, particularly for certain groups. Equally, at the same time, I'm also conscious that sometimes moving towards more digital approaches can also in itself create barriers for certain groups. So I think it's most important to have a mixture of both digital and face-to-face services. But I mean, we're still sort of seeing what the full impacts of that are at the moment. But yeah, I think really looking ahead, I think tools like this are going to become an essential part of the arsenal actually to combat gender-based violence, particularly in this country.